Hello everyone, welcome to the practical tutorial of the Indian head massage. So what we're going to do now is work through all of the 22 steps that inform the collective treatment, taking it one step at a time. So to start off, the most important thing is that we really cover the hair and the head in oil. You'll be amazed at how much oil is absorbed over the duration of the treatment. So it's really important, like we said in the previous video, that you have the oil ready to hand. You have it warming next to you so you can reach it and apply it all the way through the duration of the treatment as and when you need it. So it needs to be right by you. So start off covering all of the hair, not just on the scalp, but also all the way down to the ends of the hair, the tip of the hair. You don't want any dryness, you don't want any friction. You want to make sure there's erring on the side of perhaps a little bit too much oil than not enough. And the treatment has also been going onto the forehead, the ears and the neck and the cheek. So you want to be covering all of those areas with oil as well. Okay, once you're ready with that, to start off the treatment, move number one is to locate one of the most important marmer points on the body, which is called the adipati point, which is right at the top of the head on the fontanelle. As part of this diploma, you would have received a handout that overviews all of the marmer points we'll be looking at over the duration of the treatment, which will show you what the marmer points are called, where they are, and their indications for use. So you can refer to that when you're looking at these marmer points. So adipati is move number one at the top of the head. To find it, you need to place your little finger onto the eyebrow line, come up 4 finger widths, another 4 finger widths, and then 2 more finger widths. And where the first finger ends on the center line of the head is the adipati point. It's right at the top of the head, the crown of the head. Once you locate that point, keep your finger on it while you reach over and get your oil. And the sequence for treating this marmer point is pour, press, tap, and rub. So you need to pour about a teaspoon of the warm oil onto the marmer point. And then you press it for a count of 10. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You then tap it for a count of 10. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then the last one is to gently rub it in small circular strokes for a count of 10. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So you find the marmer point, pour the oil, press, tap, and rub. Once you've done that, you move on to move number 2, which is to locate the next marmer point, which is 2 finger widths back from the one you've just treated. So 2 finger widths back, where the first finger lands, that is the second marmer point, and that's called Shiva Nandra. Again, the information on these is in the handouts. So once you locate that, keep your finger on the marmer point so you've got the location right. Pick up your warm oil, again pouring about a teaspoon of oil onto that marmer point. So, and it's the same, pour, press, tap, and rub. So you pour, then you press for a count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You then tap for a count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You then finish by rubbing for a count of 10. So again, small circular strokes over the marmer point. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So those two are exactly the same: pour, press, tap and rub. The third move is another marmor point, which is right at the back of the head on the occipital protuberance, which is the furthest out part of the back of the head. So it's slightly different from treating the other two because you can't pour the oil onto it. If you try and pour it, it's just all going to run off. So you can't pour the oil there. But other than that, it's the same. So it's still pressing, tapping and rubbing. But because you can't pour the oil, you need to make sure you've got a good amount onto your fingers. You locate the marmor point right on the back of the head. You find it, and then it's the same. So you stabilize the head with the other hand because you're pressing forward a bit. So you hold for a count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then you tap for a count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And you finish with the rubbing move. So it's the small circular strokes for a count of 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So they're your first 3 moves. Once you've completed those, we then move on to actually more of the strokes themselves rather than the marmor point. So stroke number 4, again, you're probably going to need a little bit more oil here. So already most of it's absorbed into the hair and the scalp. So stroke number 4 is a lateral pressing stroke. So you start with your hands like that on top of the head, on the center line, and you pull down all the way over the head, over the ears, down the neck, and onto the shoulders, or to the clavicles and the shoulders. So it's again, it's not a cursory weak stroke. You're trying to create a bit of pressure, quite a pulling motion as you progress downwards. And in terms of most of these strokes, you're repeating them about 5 times each. So you're 1, 2, 3, 4, 5. It's a really grounding stroke. It's a very relaxing stroke. It's a stroke you really want to do quite consciously and mindfully. So that's stroke number 4. Stroke number 5 is working backwards over the midline of the hair, the parting, with your fingertips. So you place your fingertips together like that on top of the head. You start on the hairline at the front and you pull back all the way along the parting, the midline of the head, all the way back down onto the neck. So when you start, you're starting like that and you're pulling back like that all the way. And again 5 times. So that was 2, 3, 4, 5. So stroke number 6 is perhaps one of the hardest strokes to master when it comes to the Indian head massage, because it feels like quite an unnatural stroke, and it's called the hacking stroke. So to perform it, you put your hands together like that, as if in prayer, and then you open them up a bit so that you can see through the palms, and it's a gentle hacking stroke over the whole area of the head, but it's gentle. It's aimed to stimulate and energize the head without, it's not creating any impact as such. So to do that, it's important the movement comes from the wrist rather than the fingers. So it's a very loose stroke. You start on the center line and work back, and then you cover one side of the head and the other. So you start like that using just your fingers, and it's a gentle from the wrist, hacking all the way over the center line, all the way back to the neck, and then you do one side of the head up to the ear, not over the ear. You don't hack on the ear, round the ear, down, 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 down to the neck, and then you repeat on the other side. All the way down. And you'd be repeating that stroke collectively, so centre line, right hand side, left hand side. That would be performing that for somewhere between 30 seconds and a minute for that one. So it takes a bit of time to get that stroke right. The easiest way is to practice on yourself. If you're sitting down, just performing the motion on your thigh, so you can get used to the sensation of creating the hacking stroke without creating quite heavy impact. Once you've completed that, again, a little bit more oil. It always amazes me when you perform this treatment how much is absorbed, and usually somewhere between easily up to 50 plus mils. So you may need to make sure you've got enough oil on the burner. Stroke number 7 and stroke number 8 are using the same 3 marmer points that we started with at the beginning. But this time, rather than the paw press, tap and rub, we're pulling the hair gently over them. So to find the first one, adipati, at the top of the head, it's finger, small little finger on the eyebrow line, 4 fingers up, another 4 fingers, another 2 fingers, where it lands, right on the top of the head. You need to get a small twist of hair, which when you look at the area it covers on the scalp is about equivalent to a 5p piece in terms of surface area. And you wrap that around your finger so you can pull it up. You get the other hand and you place a strand of hair between 2 fingers. You stabilize the head with this hand and you gently pull up the hair over that marmer point. You hold it for a count of 10. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Obviously you're not putting up so hard that it creates any discomfort, but you need enough upward motion to stimulate that marmer point. Once you've done that one, you let go of the adipati, 2 finger widths back to come to Shivanandra, and then you repeat the same technique. So you get a good twist of hair between your finger, put the strand between 2 fingers on the other hand, stabilize the head and pull up for a count of 10. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then let go. And then you repeat that for the Mani Mula at the back of the head, which is, remember, the one we started on, the third one, the third move from the beginning. Again, strand of hair around the finger, stabilize the head and gently pull. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then let go. So now we're back onto some more of the actual strokes. So stroke number 9 now is a really relaxing stroke. It's a very calming stroke. It's usually a stroke that the patient finds very, very relaxing and enjoyable. So you maybe want to spend a little bit more time on this one when you're performing it. And again, you work on this one, you work on the top of the head and then one side and the other. To do it, you stabilize the head with one hand. You get your open hand like that. You place it underneath, behind the hair, so your fingers are on the scalp, and you slide the hand all the way up to the top of the head with your fingers in the hair. Once you get to the top of the head, you then perform 2 strokes. Firstly, you perform petrissage strokes, which are small circular strokes with all the fingers. So you're stabilizing the head with this hand, and it's small circular petrissage strokes all the way over the top of the head, just the top of the head at this point. A fair amount of pressure and just really gentle, relaxing petrissage strokes. Once you've done that, you then keep your hand where it is, but then you perform broad shampooing strokes as if you're washing your hair. So broad massaging shampooing strokes over the whole top of the head, but just making sure you're stabilizing the head with this hand. So broad shampooing strokes. And once you've done that for a minute or so, you then bring that hand down, and then you repeat exactly the same move, but then from this side of the head and then the other side of the head. So you stabilize the head with this hand, open fingers onto the scalp, slide up one side of the head. When you get to the top, small petrissage circles on the right hand side of the head, all the way down to the ear, past the ear, all the way down to the hairline, and then back up, and then broad shampooing strokes over the whole right hand side of the head, all the way down past the ear, all the way down to the hairline and the collar line. And then you repeat on exactly the same, but on the other side of the head. So hands through the hair to the top, small petrissage strokes over the whole side of the head, down past the ear, and then back up, and then broad shampooing strokes. So that move, you do it 3 times. You do it from the back, you do it from the right, and you do it from the left. Once you've done that one, the next move is very similar to the previous move, but rather than working from the bottom up through the hair, you work on top of the hair, and you work starting from the top. So again, a little bit more oil, covering, making sure it's really well lubricated. And then you perform 3 separate strokes as part of this move. So the first one is using both hands, is broad shampooing strokes over the whole top of the head, and then working down both sides. So just really gentle, relaxing, calming, soothing, broad sweeping massage strokes over the whole head, working down past the ears, all the way down the hairline and onto the neck. You want this to be a very grounding, relaxing stroke. So you don't want to be rushing. You want this to be slow, gentle massage shampoo strokes. Once you get down to the bottom, you then do the same pattern working down, but rather than using broad shampooing strokes, you use the small petrissage strokes. And it's easiest to do this one side of the head first and then the other. So first off, you stabilize the head with one hand, and then you just, with 2 fingers, just perform small circular petrissage strokes all the way over the top of the head, and then down one side of the head to the ear, behind the ear, down to the hairline, and then making sure you cover the back of the head as well. Just very relaxing, small circular petrissage strokes down the head. And once you've done that side with petrissage, you then repeat on the other side, so exactly the same, stabilizing the head with one hand, 2 fingers, and just gentle, small circular petrissage strokes all the way down that side of the head. And the third stroke of this move, move number 10, is broad rubbing strokes. So again, do one side of the head at a time, stabilize the head with one hand. With the whole hand, palm and fingers, you rub the whole surface area of the right hand side of the head. Starting at the top, gentle, broad rubbing strokes all the way down past the ear, down onto the neck, and then you repeat that on the other side. So stroke number 10 has got 3 different moves to it. You've got the broad shampooing, you've got the small petrissage, and then you've got the rubbing. Okay, it's definitely one of the moves you want to prioritize. That whole move number 10, and all the strokes that make it up, needs to be lasting for a good couple of minutes. It's one of the strokes that really helps the patient to relax. You can almost feel the body tension coming out of them. You can feel them getting a little bit heavier, a little bit looser as you perform that. So it's definitely one you want to prioritize. It's one you want to do mindfully, and give it enough time for it to be effective. Once you've completed stroke number 10, we've got stroke number 11 and 12, which are called pressing and lifting strokes. So the stroke number 11 is you're working on the temples. So with this one, you're stabilizing the head with the palms of the hand over the ears. So the two fingers land on the temple region, both sides. And then you gently press in and lift up. But we're talking millimeters of lift here. This isn't an osteopathic alignment or a spinal alignment. It's just a very gentle lift. So you're stabilizing the head, fingers on palm, squeeze in and lift, and hold for 5. 1, 2, 3, 4, 5, and then let go, and then repeat. Squeeze, lift, 1, 2, 3, 4, 5. Let go, and repeat that one more time. So squeeze, lift, 1, 2, 3, 4, 5. That's stroke number 11. Once you've performed that, stroke number 12 is exactly the same move. It's squeeze and lift, but rather than being from side to side, it's front to back. So you put one hand on the forehead, one hand on the back of the head, and you squeeze and you lift. So together, gently squeeze, lift, 1, 2, 3, 4, 5. Let go, and then again. Squeeze, lift, 1, 2, 3, 4, 5. Let go, and repeat it one more time. So gently squeeze, lift, 1, 2, 3, 4, 5, and then let go. So they're energizing strokes. It's really important to just emphasize how minimal the lift is. So you're gently squeezing, gently lifting. You don't want any kind of pressure or strain on the neck or the spine through doing that. So that's stroke number 12. Stroke number 13 is now working on the forehead. It's again a very, very relaxing, calming, grounding stroke, and it's a lateral pulling of the fingers over the forehead. So you're like that. You meet with both fingers on the third eye, in the middle of the forehead. You stabilize the head with the palms of your hand and pull it into your chest if needed, and you pull the fingers back all the way over the temples, over the ears, and down the neck. Okay, so it's a really calming, lovely, relaxing stroke. So fingers meet on the third eye, on the forehead, pulling back all the way past the temples, over the ears, down the neck. And you want to repeat that for 5 strokes. So we've done 2, so 3, 4, 5. And again, if you think that the patient needs a little bit more relaxation, then you could repeat that stroke maybe 10 times to make it slightly more relaxing, because it's a very, very calming stroke. Stroke number 14 then focuses on another marble point we haven't covered yet, which is called the ajna point, which most people know as the third eye, which is right in the center of the forehead. So the best way of locating that, making sure you've got plenty of oil, is if you place your second finger onto the eyebrow line, the line where the eyebrows meet, where the first finger lands is the ajna point. So you just want to put 2 fingers onto that point, And then to treat this marmer point, you do anti-clockwise stroke and then a clockwise stroke. So classically, you would, if I'm this side, if you were this side, you go anti-clockwise for 11 circles. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Stop, and then 11 strokes clockwise. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. And the ajna point, the third eye, is one of the most important marmer points on the body. Again, the indications for using it are on the handout that came with this course. It's really important to familiarise yourself with those because there's so many benefits to using that marmer point. Things like headaches, even things, poor concentration, those kinds of things. So it's a really powerful marmer point to be using, and if it's needed, you can use that for a lot more. You can do that for more than 11 strokes. So once you've done that, we then move to another marmer point, and you do that by sliding your fingers back from the third eye, so that you've got 2 fingers resting gently on both temples. You then perform the same treatment on these ones. So it's 11 anti-clockwise and then 11 clockwise. So you can do them both at the same time, or you can do one at a time, depending upon how easy you find the movement. So this one here, so it's 11 anti-clockwise. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Stop, hold, and then 11 clockwise. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. If you've done them both at the same time, then that's fine. If you've done one each, then obviously you need to go to the other side and repeat that on the other temple, 11 anti-clockwise and then 11 clockwise. Again, just checking for the amount of oil, and just checking whether you need to use any more. So that was stroke number 15. So stroke number 16 is a longitudinal stroke down behind the back of the ear. So you start up, and you want to make sure that the skin behind the ear and the neck is well oiled. If you haven't, it's quite easy to have oiled the hair well, but you want to make sure there's no friction behind the ear. You start off, you stabilize the head with this hand, start off with 2 fingers right at the apex of the ear, right at the top of the ear, and you slide down behind the ear all the way down the neck to the collarbone. So really, you want this to be a slow, gentle, pressured stroke. It's a really grounding stroke as it works down. So repeating that 5 times, so all the way down the neck. 2, 3, 4, 5, and then you repeat that on the other side. So exactly the same, down 5 strokes down behind the ear. Once you've performed that, the next stroke is exactly the same move, but rather than being a downward stroke straight down, it's a downward stroke with small circular strokes as you move down. So you start at the top of the ear, and rather than doing that, which was the previous move, you start, but as you go down, it's small circular petrissage strokes down exactly the same track as the previous stroke, but with petrissage circles. And then back up to the top and repeat that 5 times. So 2, 3, 4, and then lastly 5. And then obviously you then go to the other side and you repeat exactly the same motion as the downward movement with the circles to petricide circles as you move down. We would then treat 3 new marmer points which we haven't looked at yet. Again, they're on the ears and the eyes. So there's 2 on the ears, 1 on the bridge of the nose. The information around those indications, like the other ones, are on the handout. So the first one we treat is right at the top of the ear, the apex of the ear. It's called ukshepa. It's a small marmer point, so you only need to use 1 finger. So you stabilize the head with this hand, so it's nice and steady. 1 finger right where the ear meets the skin of the head. 1 finger, pressure, then 11 small anti-clockwise circles. 3, 4, 5, 6, 7, 8, 9, 10, 11. Press, and then 11 clockwise circles. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. And then you repeat, you slide down the ear, behind the ear. So you slide from that marmer point all the way down the ear to the next marmer point, which is directly behind the earlobe. So if you had your finger on the earlobe, where it can come out the other side, right behind it there's a very, very pronounced divot or hollow. The marmer point is directly in that hollow. It's very small. It's about the width of your finger. It's quite sensitive. You don't want a lot of pressure on that point. You just want enough to stimulate it. The marmer point is called vidhura. So it's exactly the same. Finger into the hollow. 11 anti-clockwise strokes. Stop, pressure, and then 11 clockwise strokes. 7, 8, 9, 10, 11. Once you've done that, you then repeat on the ear on the other side of the head. So exactly the same, starting at the apex, then moving down to behind the earlobe. So you do 1 ear, then you do the other. Once you've done those 2, the 3rd marmer point is the ashru marmer point, which is right between the bridge of the nose. So where the eyebrow meets the bridge of the nose, that's the marmer point. So there's 1 each side. So you can do it one of 2 ways. You can do 1 at a time. So if it was this one here, the marmer point is there. So you stabilize the head, 11 anti-clockwise strokes, 6, 7, 8, 9, 10, 11, hold, and then 11 clockwise, 4, 5, 6, 7, 8, 9, 10, 11, and then you go over and you go across to the other side, and then you repeat. So you can do one side and then the other, or you can use finger and thumb, and you can do both at the same time. It doesn't matter, it depends upon what you find becomes more natural and feels easier. But the key thing is that you do treat both. You don't just treat on one side or the other, you do both. So 11 anti-clockwise, 11 clockwise. Once we've done the 3 on the face, the next stroke is working on the eyebrows. It's a lateral stroke pulling across the eyebrows. Again, it's a grounding, calming, relaxing stroke. You want to make sure that there's enough lubrication and oil on the forehead and the eyebrows, because you might not have worked on those before. You don't want it enough that it starts dripping down into the patient's eyes. So for this one, it often helps to stabilize the head on your chest. You take your 2 fingers and then you're pulling across the eyebrow all the way to the temple region. It wants to be, it's not a cursory skimming stroke. You want to be creating pressure. As you're pulling, you want to be stretching the skin of the eyebrows. So it's great for aesthetics. It's great for the skin and the facial tone around that area. So you're stabilizing the head and you're pulling across the eyebrows all the way to the temple region. And you're repeating that for 5 strokes. 3, 4, 5. After that, the next 3 strokes are really one of the most relaxing moves. So we're up to stroke 20 now, and there's 3 separate strokes of move 20, and they work progressively down the face. So the first, and it definitely helps to stabilize the head on your chest for this one. So the first one is starting at the hairline, starting at the top of where the hair meets the forehead. You slide down the center line of the forehead all the way to the eyebrows. You then pull across the eyebrows like the previous move, down across the temples, over the ears, and down the neck. So it's really grounding, relaxing stroke. And you will be repeating that at least 5 times. So down the forehead, onto the eyebrows, across the eyebrows, onto the temples, down the ears, down the neck to the collarbone. You do that for 5 strokes. You then move down and repeat the same movement. So forehead down, but rather than going across the eyebrows, you go down the bridge of the nose, underneath the eye, across the cheekbone, over the ear, and then down the neck. So it's exactly the same move, but rather than being on the eyebrows, you go down underneath the eyes and across the cheekbone. So down, bridge of the nose, onto the cheek, and you're pulling up to the temples, and then down. You want to see the cheek, the flesh on the cheeks stretching as you're pulling up. It's a really toning, anti-aging treatment of the skin around the cheek. So you're repeating that 5 times. So 3, 4, 5, and then the third stroke of move 20, you go down another layer. So, and then you get all the way to the chin. So rather than finishing on the cheeks, you go down, forehead, between the eyebrows, across the bridge of the nose, down the cheeks, all the way to the chin. So you finish with both hands on the peak of the chin, and then you pull up all the way up to the temple, and then down the ears and onto the collarbone again. So it's a full facial treatment. So you're going down the forehead, through the eyebrows, over the nose, down the cheek, round the mouth, both hands on the chin, and then pulling back up, round the ears, and back down the shoulders. And you're repeating that 5 times. So down, chin. The most important thing with this move is when you get to the chin, you really proactively pull up as you're coming back up. You want to be stretching that skin, and you repeat that for 5 strokes. So move 20 has got 3 separate strokes, each which you perform at least 5 times, depending upon how much time you've got. Stroke 21 is another fantastically grounding stroke, and like I said before, if you've got a patient you're treating or using Indian head massage for things like stress, anxiety, tension, this is a stroke you really want to emphasize. It's a sweeping stroke across the forehead and down the neck. So you do one side and then the other. So first off, you turn the head to one side. I'm just going to turn the body a little bit. You stabilize the head with one hand, so it's nice and stable. You bring your other hand across so that your fingers land on the temple. Stabilize the head on your chest, and as you sweep your hand all the way across the temple, all the way down the ear, behind the ear, down the neck, all the way to the collarbone. So it's sweeping all the way across the forehead, down across the temple, behind the ear, and you do that for 5 strokes. 3, 4, 5, and then you do the same stroke, but rather than coming behind the ear, you go in front of the ear. So you're pulling across the forehead, over the temples, but this time coming down the front side of the ear, across the jaw, and down onto the clavicle. So it's exactly the same movement. Across the forehead, front of the ear, down to the collarbone, and you perform that 5 times as well. So from the other side, you turn the head that way. I'm just going to spin you that way. You turn the head that way. You stabilize the head with this hand, and then you go across the forehead, all the way across the temple, down behind the ear, all the way onto the collarbone. So that's 5 strokes. So 5 strokes behind the ear. 3, 4, 5. And then you repeat exactly the same stroke, but rather than coming behind the ear, you come in front of the ear. So 1, 2, 3, 4, 5. And then you center the head. So for that move, for move 21, you do one side, and then you do the other side. And that's it. One more stroke to go, which is stroke 22, which is a grounding stroke to finish off the treatment. So it's working back on the adipati, the move we started with. Move number 1 was locating the marmor point on top of the head, adipati, which remember is 4 finger widths, 4 finger widths, and another 2 finger widths right on the top of the head. To end the treatment, you place your palm of one hand over that point, the palm of the other hand on top of that, and you press gently down for at least 2 minutes, 2-3+ minutes. It's a grounding, nourishing, calming stroke. There's the option of breath matching, which is where you try to regulate your breathing to match that of the patient. It's easy to do from this position because you can see the rise and fall of the shoulders and chest with the inhalations. That's a classical way of ending the treatment, but you haven't got to do that. The most important thing is you've got nice steady pressure on that marmor point, pressing gently down and holding that for 2-3+ minutes. Once you've done that, you then take your hands off, step away, and that's the end of the treatment. But the important thing at this point is that you don't undo the gains that have been achieved through disturbing the patient. They need to stay there in a zoned out state for at least 5 minutes. They don't start cleaning up the room, banging the pan with the oil in or tidying up. Either sit down quietly or leave the room and leave them for 5 minutes just to regather themselves and regroup. Then come back in and gently bring them back into the room and just find out how they are and make sure everything's okay. And at that point, the treatment will have ended.